and welcome back to another great video where we will discuss two other very common conditions, one being GERD, which is Gastroesophageal Reflux Disease, as well as IBS, which is Irritable Bowel Syndrome. A lot of our clients come to us asking us, how do we get service connected for these conditions? Sometimes they're lumped together as well. And so today we'll discuss some of the symptoms that you may be experiencing, as well as how the VA rates these two particular conditions. And so today I have Dr. Wynn with me, who is our head doctor here in the firm. She deals with all of our medical stuff regarding anything other than PTSD or mental health. And she's going to be explaining how we have served a lot of veterans with nexus letters as well as DBQs and what this particular condition means. So Dr. Wynn, GERD, Irritable Bowel Syndrome, what does this all mean? What is it? What are my symptoms, and how do I go about getting it done?
Yeah, these are two really common symptoms that we see. So as mentioned, GERD is essentially reflux, and then Irritable Bowel Syndrome is IBS. They often actually occur together and are thought of as motility disorders, which just means process of moving food through the digestive system, with increased sensitivity of the digestive system. So some symptoms for GERD reflux is heartburn, regurgitation of actual stomach contents, sore throat, you can have a chronic cough, difficulty swallowing, nausea, vomiting, even chest pain, and that does present and lead to emergency department visits because it's concerning for a heart attack. IBS, on the other hand, there is some stomach pain, but there's also bloating, gas involved, cramping, and some changes in your bowel habits like diarrhea, constipation, episodes of that. So some of the causes for Irritable Bowel Syndrome, as mentioned, GERD and Irritable Bowel Syndrome actually can increase the risk of one with the other. It's not really certain what causes IBS, but there is a gut-brain connection as lifestyle changes like decreased stress, food changes do improve IBS. So a family history of IBS, severe stomach infection, those things can actually lead to the development of IBS. Some causes for GERD, there's a ring of muscle at the bottom of your esophagus, which leads to the stomach, and usually that is within normal limits. It's not loose and it's not extra tight. It prevents reflux from happening. But when it does become weakened by things like obesity, pregnancy, smoking, eating large meals before nighttime, going to bed, then it can loosen and become weak and lead to the reflux.
Wow. So we've covered a lot about some of the symptoms you're experiencing, as well as things that cause these conditions. I want to get into what a rater thinks about these conditions. And so three things are what we need to be successful with this case. We need a diagnosis from military service, we need an event in military service, as well as a nexus, and that ties these things together. And more importantly, the severity of these conditions also indicate which percentage a rater should rate you at. And so what does that include? So Irritable Bowel Syndrome, and if you're looking for this on your own through the CFR or online, and the CFR is technically Irritable Colon Syndrome. So yes, that is very confusing. On your rating or on your VA decision letter, it may say Irritable Bowel Syndrome, but if you're looking for research on your own, if you want to find it, you have to look up Irritable Colon Syndrome, and the diagnostic code is 7319, as you can see here. Now, to get 30% for this condition, which is the highest that the rate said, you have to have severe diarrhea, alternating diarrhea, and constipation with more or less constant abdominal distress. With constant abdominal distress, that's for 30% for Irritable Bowel Syndrome. What does that mean for a veteran? What must they express to articulate this happening at that level?
So pretty much it means that they're experiencing those symptoms multiple times a day or pretty much daily.
Okay.
So just very, very frequent, obviously disturbs your life consistently. So that's what the distress is referring to.
And disturbance of life, that could be taking time away from work, not being able to enjoy time with kids and family members.
Yes, with the constant cycle of having constipation within diarrhea, you can imagine they're spending most of their time in the bathroom, away from their desk, away from family, maybe in the middle of commuting, being late for work. So it's very, very disruptive to life.
Wow. So veterans, as you can see, this huge disruption is equivalent to only 30%, which I think is a little low. That's because I'm pro-veteran, I'm a veteran myself. I think it should be probably 60 or 80%, but at that level, we're looking at 30%. This condition rates 0, 10, up to 30. So the next lower evaluation will be moderate, frequent episodes of bowel disturbance with abdominal distress. And 0% means that it's mild. Now for hiatal hernia, which as we expressed before is GERD, if you're looking into CFR, it does get very confusing once again. If you try to look up GERD, you may find some credible evidence out there or credible resources about this particular condition. But if you're looking into CFR, it's rated under diagnostic code 7346, and it's identified as hernia hiatal. And it rates top in at 60%. And those symptoms would include pain, vomiting, material weight loss, or melena, or moderate anemia. And I may be mispronouncing that, I apologize, I'm no doctor by any means, but I understand how to get the money for this particular case. And at 60%, that's what it entails. And so, Dr. Wim, at 60%, we're looking at symptoms of pain, vomiting, material weight loss. There's an H word in here, I can't remember. Or melena or moderate anemia. What do these big terms mean for the average veteran that's looking at this information and trying to understand hiatal hernia, I have a lot of symptoms, make medical sense for us? Yeah,
what it means is that the reflux has led to the point where it's so severe that you have now weakened that set of muscle at the bottom of your esophagus so much that your stomach is actually perhaps pushing through towards the top.
Oh, wow.
So it's very, very severe symptoms, or you're at an increased risk for deficiencies like low red blood cell count, which leads to the anemia. And those things can be really chronic, and you might not even have the other symptoms, but if you have things like anemia, it does show that it affects your life tremendously, which leads to the weight loss, which can lead you to have other issues as well.
Wow, wow. A lot of great information, vets. And the lower evaluation of this is 30% and then 10%. So at 30%, we're looking at persistent recurrent epigastric distress with dysphagia, cirrhosis, if I'm pronouncing that right. I have P-Y-R-O-S-I-S. I'm probably butchering that. And guys, this is raw content. We're giving it to you straight from the book and exactly how we end up coming up to a conclusion on how to serve as a veteran. So if you guys are making jokes on me, go ahead. Please, make jokes on me. I cannot pronounce none of these words. But we have dysphagia, cirrhosis, and regurgitation accompanied by substernal or arm or shoulder pain, productive of considerable impairment of health. And so that's a lot of words there. And that's at 30% level. For someone like myself, as well as other veterans, we understand what we're experiencing internally. We may not be able to articulate those symptoms very clearly. What do these big words mean? Dysphagia, cirrhosis, regurgitation. And if I'm mispronouncing that, please correct me. Like I said, I know how to give you the money, but saying the words, I suck with that. So what does that mean?
Yeah, so it means that you're having difficulty swallowing, which is the dysphagia, and the pyrosis is the burning sensation that you might get like in the back of your throat or in your chest. And then the regurgitation is just the stomach contents coming up. And while you may not actually vomit up the stomach contents, they're still, coming up into your mouth, past your throat. So it's all very uncomfortable and affecting your life tremendously.
Wow. So guys and gals out there that are looking to get your claim increased or looking for a secondary condition, before we go, secondary condition, what could these conditions cause? And more importantly, what may cause these conditions if they already are service connected for something else? Is that possible?
Well, as mentioned, you can also have like a hiatal hernia, and that could be related to, many other things that cause the diaphragm muscles to be weaker.
Okay.
Which I guess you can speculate and relate it to other types of claims as well, depending on what the specific injury has been in the past. So that would be individualized, and we would talk to you about that.
Yeah, absolutely. And so speaking of individualized, we have a lot of clients that will compare apples, what we call apples to oranges, but the clients think it's apples to apples of your case and another veteran's case. So it's an individual effort. Obviously, we serve everyone collectively, but it's individualized. And so if you're in a position where you feel as if one condition may cause this, that may or may not be the case. The best thing to do is, of course, schedule a consultation with our team. We, of course, look into it and see what we can or cannot do and advise you going forward. And so thank you once again for being a part of our video. I hope that you have found great content for what we can deliver to you, and that more importantly, whether you're our client or any veteran across the world, that you can find some type of results in your VA disability claims. Thanks for joining us, and let's win.